Patients change providers when they don't feel satisfied with that provider. And there's lots of reasons why patients may not feel satisfied. And one of the things that we've heard, especially relating to sort of LGBT issues, is not feeling safe or feeling judged by their providers in terms of when they've disclosed either their gender or sexual identities to their providers. So for example, hearing things like, so when a patient tells their provider, oh, I think I'm gay or I'm gay, and the provider retorts with something like, okay, well, make sure you use a condom because there's a lot of diseases in your community. That sort of response, or saying things like your community and creating an othering, so to speak, of an environment, does not create a comfortable space. And so patients are likely to leave, or if they can't leave because of insurance issues or HMO issues or whatever it is, they may simply not fully disclose everything to you, and then you don't actually have the information that you need to help make appropriate medical decisions or provide therapies. A thing that we've heard many times is when patients have disclosed information about their sexual activity, and whether it's been LGBT patients or even other non-LGBT patients, when they've disclosed having sort of multiple sexual partners or not using condoms, people have had very sort of judgmental experiences of, oh, that's horrible that you didn't use a condom. Oh, that was very bad of you to not use a condom. Or you should really practice abstinence. And so when we say things like this, that immediately shuts the patient off. It doesn't actually create an open and inclusive environment. And and you've pretty much lost the patient there. And so sexual health ends up being a very touchy subject, especially for our younger patients who may not have many other comorbid medical conditions that need care. This is sort of true across the board. And so so those are some of the things that we've heard a lot, is feeling like their provider was going to be open and non-judgmental, but once they've disclosed things, they've experienced either stigmatizing language, or they perceived, because whether it's the tone, the body language, or whatever it was, the patient perceived that they probably weren't in the safest space, and have switched providers as a result.